question, the member for Scarborough-Guildwood.
Thank you, Speaker. My question is to the Minister of Education. We just have over 6 weeks remaining before back to school begins. And yet there is no provincial guideline to help families set expectations or give confidence in the safety of their children in classrooms. Yesterday, the Premier stated that he hopes students will return to school 5 days a week, but he has not taken any real steps towards making that a reality. The government expects school boards to draw up plans based on 3 scenarios from scratch, with no standard guidelines or additional funding to rely on. The province's hybrid scenario has been widely rejected by a number of school boards, including Halton, which cites the lack of available childcare spaces, making this option unworkable, which the minister should know. Will the minister consult with public health officials together with educators to make a safe return to school possible and protect Ontario's 2 million students and over 300,000 education workers? Or will he try to do it on the cheap?
The Minister of Education.
Thank you very much, Mr. Speaker, and thank you to the member opposite for the question. Indeed, we are absolutely committed to working with the Chief Medical Officer in Public Health Ontario, as we have to date, to ensure our kids remain safe. Let it not be forgotten, Speaker, was this government the first in this country, one of the first in the industrialized world, that closed schools, very much because the evidence suggested the risk to children. And so that's why, Speaker, we took that action then. It's why we are taking action today to ensure that we are prepared for all 3 circumstances, to ensure children remain learning in class day to day, as the government has clearly suggested remains the aspiration, something I think parents and working people would like. Obviously, we're preparing for a potential second wave, and in that preparation, ensuring that there's a formula that has been supported by public health of a reduced amount of quantum of students in class at 15, cohorted using the adaptive model, and yes, an online model should we have to, God forbid, close schools again. Obviously, the latter 2 options are not our preference, Speaker, but it is prudent and it is responsible for any government to be prepared for that the very unknown that may manifest in the next 30, 60, 90 days. We will continue to invest,
Response.
we'll continue to support training, we'll do everything it takes to keep these kids safe.
And the supplementary question.
Thank you, Speaker. And I think it's great that we were the first to close schools. And that's why I would expect that we would be in a better state of readiness, because the bottom line is we're not ready.
Order.
We have detailed plans for reopening bars, but not for classrooms. Bars have standardized protocols in case of an outbreak. They keep track of their patrons' contact information for a period of time, and if contact tracing is needed, there is a process. Basic rules and requirements for returning to school are still unclear. If you get on the TTC today or the GO transit system, you know you got to put on a mask. Do we need to do that in schools? We still don't know. What even is more unclear is what will happen in the case of an outbreak. You've said that you're preparing for a second wave. So my question is, given the fact that we know that there's likely going to be a second wave, cases are now over 200 today, what will you do if there is an outbreak in terms of testing and contact tracing in schools? What is the plan?
Thank you. Minister of Education.
Thank you very much, Mr. Speaker. Obviously, the Chief Medical Officer of Health, led by the command table and working in conjunction with the Deputy Premier, have been very much engaged in developing this protocol. And I appreciate that our educators, and likewise our staff, our parents, our communities, all of us have an interest in ensuring that that medical advice reflects the risk profile of the time. And as we look to the data over the last few weeks, we've seen some progress as a consequence or a result of the people of Ontario doing the right thing, staying home and adhering to public health advice. As a result of that good work of the people of this province, we are prepared and we're moving towards conventional delivery. But having said that, Speaker, our obligation to school boards, and I express gratitude to them for their hard work over the past weeks preparing, is to ensure that they get the best advice from the Chief Medical Officer. We've ensured that we've created a command table, if you will, of medical experts that will review each of the board's plans. We've also ensured that there's more training in place for all workers and educators in school boards. As I've been clear, we will do whatever it takes to keep kids safe in this province, Speaker.